we know that about half of women, for example, that have depression, about half of them it's related to early childhood trauma. So early trauma, is really, which affects maybe up to 10-15% of people, um, is really a key driver of a lot of these. But not everybody develops PTSD. Some people develop depression. Some people develop something called borderline personality disorder, and it still may be linked to things in their childhood. And then, we know that there's a over tenfold increased risk of using injected drugs, namely heroin, if you have a history of three or more childhood traumatic events. So it's a spectrum of disorders that, if you look at people who meet the criteria for PTSD, whether it's from combat or from rape or a train wreck or car accident, they do look similar. Like the symptoms are similar. The only differentiation I would say would be that when people have early trauma, they tend to get more complex PTSD. So they have the core diagnosis of PTSD, but then have other associated symptoms like depression or dissociation.
Again, I just don't know what that all entails.